Welcome back. So last time we wrapped up with all of the stuff on assessment. There were really only 2 chapters on that, but we wrapped both of those chapters up. And so now these next 3 chapters essentially talk about the components of a workout. So chapter 14 gets into the warm-up and flexibility training, so kind of the warm-up and cool-down. Chapter 15 talks about free weight and machine training, and then chapter 16 talks about things like strongman training and variable resistance and a bunch of other things like that. So now we're kind of into the mechanics of a workout in these next 3 chapters. So with respect to the warm-up, so as you're aware, warming up enhances performance, right, rather than just going out cold and starting exercising. And with respect to the specifics of what a warm-up does to enhance your performance, you can see those here. So faster muscle contraction time and faster muscle relaxation, improvements in the rate of force development and reaction time, improvements in muscle strength and power, lowered viscous resistance in the muscles. So viscosity, as we've discussed before, is kind of the thickness of a fluid. And so if we say that muscles are less viscous, it means that they are more pliant, more stretchy, more elastic, all of those kinds of things. And so that's the lowered viscosity. It's easier to fully extend that muscle, to contract that muscle, et cetera. It takes less energy to do that. Increased blood flow to the active muscles. So one of the things that happens when we start exercise is that we release the catecholamines, epinephrine, norepinephrine. Those neurohormones are going to increase heart rate, increase cardiovascular contractility. But one of the other things that they do is that they're going to cause systemic vasoconstriction. So they cause blood vessels to close down, including in the working muscles. So what happens is that, let's say you go running, you're going to get initial systemic vasoconstriction. You're going to close down blood vessels in the legs. And then, after you've been going for a few seconds, you're going to get an accumulation of metabolic byproducts in those muscles, let's say in your gastrocnemius and in your soleus, your hamstrings, et cetera. And so that the accumulation of those metabolic byproducts, adenosine diphosphate, extra hydrogen, which will then cause a decrease in the pH of the muscle cell, increased carbon dioxide, all of those molecules act as signaling molecules to cause reflexive vasodilation then. So effectively what happens is when we start working out, we close all the blood vessels down throughout the body, and then the level of the working muscles, in response to those, again, metabolic byproducts, we will open up blood vessels in the muscles that are working. And so that takes a few seconds for that to happen. And so if you just go from not doing anything, you're in a seated position to running, in that interval, you're going to start to accumulate more hydrogen, more lactate, et cetera, and so the muscles will fatigue more quickly. As opposed to if you do a warm-up, you've already gone through that process and you've opened up the local blood vessels, and so you can get more oxygen to that working musculature whenever you start the actual competition. So if you do, let's say a 10-minute jogging warm-up, and then you do a race, you'll have already gotten past that, again, initial vasoconstriction, so that you can, as soon as the race starts, supply a maximal amount of oxygen to the working musculature. So that's one of the important things that a warm-up does. Another way of viewing that is that it reduces the oxygen deficit. So thinking back to something we talked about near the beginning of the class. Enhanced metabolic reactions. So you get the citric acid cycle going, you get the glycolytic process going, all of those things when we activate the muscles during the warm-up. And that way, whenever, again, you start your competition, all of those are already primed to produce energy aerobically. And then increased psychological preparedness, because as part of the warm-up, you're going to go through some of the really specific drills related to your sport. So if you're a football offensive lineman, you're going to do some practice blocking drills. If you're a baseball or softball pitcher, you're going to do some throwing, right? And so that lower intensity throwing kind of helps get you in the psychological state, improves your arousal, to tie it back into another thing we've talked about earlier, so that you're ready when the actual performance time comes. So as discussed in 345, so the warm-up is going to start with it's going to start with a general warm-up period where there's just this general aerobic exercise. Oftentimes that's a light jog, but it can be other things, right? So if you're a cyclist, maybe that is a low intensity 5 to 10 minutes, or if you're a swimmer, some kind of low intensity swim for a few minutes before you do more specific stuff related to your actual event. So there's the general warm-up period, 5 to 10 minutes, slow activity like jogging or skipping, and then we do the specific warm-up, which includes the components of the actual sport movements themselves. So again, for a football offensive lineman, it's blocking. For your throwing athletes, it's throwing. For tennis players, serving, those kinds of things. So that's part of the specific warm-up. And as you can see there, and as we talked about in 345, the whole process typically takes somewhere between 10 and 20 minutes, depending upon the complexity of the sport, the level of conditioning of the athlete, and a few other factors. So the protocol that they call for a warm-up is the RAMP protocol is what they call it. I don't know that it needs an acronym, but whatever. So the R there is raise, so you're going to raise your body temperature. That's the most important thing there. But in addition to elevating body temperature, you get increased heart rate, increased breathing rate, which is respiration, increased blood flow to the working muscles. You increase, interesting, that should be decreased viscosity of the joint fluid, but whatever, we'll leave that for now. They are then, you're increasing your core temperature, right? You're getting a sweat going, getting a lather going, if you will, right? And then we're going to activate and mobilize. So we're going to have them go through the range of motion. So that would be like the dynamic warm-up. So, a common warm-up protocol would be jog for 5 to 10 minutes. And then we're going to have them do a variety of dynamic warm-up exercises where we have them do things like they're going to do a lunge, and then they're going to do a trunk twist or a lunge and, reach over the top of their head. And so in doing that lunge reach combination, that's activating and mobilizing. So now you're working on different types of muscle contraction, isometric contractions, stronger concentric and eccentric contractions than during jogging if you're doing some of these lunges and reaches. And so again, you're also going to be moving through full range of motion, hopefully, or full active range of motion during that warm-up. And then potentiate, so we're going to perform our sport-specific activities, working our way up slowly. So, start with some light, baseball example. Start pretty close together with a partner, do some light throwing, get progressively farther apart, and then increase the intensity of the throws as you continue the warm-up. So that's potentiation. You're doing the actual sporting activities. Flexibility. So as you can see there, flexibility is a measure of range of motion. The abbreviation of that is ROM. And it has static and dynamic components. Static flexibility is passive. So that can be somebody moving you through your range of motion, or another type of passive stretch that an individual does to themselves. If you think about how you would stretch your hamstrings, put your foot up on a chair and lean forward, something like that. Or if you want to stretch your calves, put your foot on a step and kind of step down and force your ankle into dorsiflexion. All of those are examples of static stretches. So you move the joint to essentially its end range of motion, and you hold it there for somewhere between 15 and 30 seconds. So that's done passively through, in the case of the calf stretch, through your body weight, or the hamstring stretch through body weight, or done by a partner. And so what I've got there, the goniometer, that's measuring passive range of motion there, pushing somebody in that position and then measuring how far they can move. And then dynamic flexibility is range of motion during active movement, so it's going to require voluntary contraction. So dynamic flexibility movements would be like toe touches would be an example, and there are pictures of these in the Chapter 14 supplement. So where you would be, start at the goal line if we're a football player, and have them take a step and then kick their leg forward with their knees straight, so hip flexion, knee extension, and then try to touch their toe. Let's say their right toe is with their left arm, and then vice versa. That would be dynamic stretches, because you're going to use the hip flexors as you kick your leg up to stretch the hamstring. So you're using the agonist to stretch the antagonist in that case. So that would be a dynamic flexibility type of an exercise. So factors that affect flexibility, the joint structure. Obviously the basic structure of the joint determines the range of motion. So, in the elbow, you get 180 degrees. Actually, it's a little bit less than that. And it varies depending upon how much musculature they have. So you'll see less range of motion the more musculature that they have, which is the bottom thing on this slide. So for example, if somebody has a really well-developed upper arm, they've done lots of curls, when they move into elbow flexion, they're not going to be able to go quite as far because you're going to have the muscle tissue of the forearm flexors touching the muscle tissue, their biceps, of their upper arm, and so that'll reduce their range of motion. But one of the things that I mentioned or am thinking about related to joint structure is that if you have alterations in joint structure, which can be fairly common, then that will affect range of motion as well. So for example, thinking about something like the hip, if somebody has hip impingement where they have a different shape to the femoral neck or they have a different shape to the acetabulum itself, that's going to affect range of motion, particularly into hip flexion. So alterations in joint structure are going to affect range of motion as well. Age and sex, younger people are more flexible than older people, and then women tend to be more flexible than men. It's not universal, but that's kind of the general way that it goes. If we're measuring flexibility, their stretch tolerance is going to affect that. So if you think of somebody doing like a sit and reach test where they're seated and they're going to slide their hands forward, on the old yardstick and see how many inches they can get of hip flexion and trunk flexion. That's the hamstring flexibility test. Their ability to tolerate the discomfort of their hamstrings being stretched is going to affect how far they can reach on the sit and reach test. So that will be something that will affect your measurements. Neural control, especially with active range of motion stuff, being able to appropriately activate the agonist and relax the antagonist will affect their active range of motion pretty significantly. Resistance training, so when you increase muscle strength, when you increase muscle size, that affects range of motion. So increased muscle strength, if you lift weights chronically, that increases what's called the muscle's tone. And so tone in this sense isn't an aesthetic, it's not a look. It is that the muscle has a lower level of resting contraction. That's muscle tone. And so if you are chronically resistance trained, you'll have higher muscle tone, which means that even at rest, the muscles have a higher level of contraction, and so then contracted muscles increase the stability of a joint, right? And so then that will affect one's flexibility and range of motion. And then similarly, if they've added a bunch of muscle mass, that's going to affect how far you can move a joint through its range of motion. So like I talked about with the elbow flexors and forearm flexors touching each other, if somebody's a bodybuilder, for example, and has really big biceps and really big forearms, they're going to have less elbow flexion range of motion than somebody like a cross-country runner that will not have a really well-developed upper arm related to muscle bulk. Activity level, the more active people are, the more flexible they tend to be, but that just being active doesn't increase flexibility necessarily. So for example, if you've got a distance runner who never stretches, they're probably going to have some fairly tight hamstrings and some fairly tight hip flexors. Now they're probably more flexible than sedentary controls, so somebody who just doesn't move and sits all day, but they're not going to be as flexible as they could be or as their peers are who stretch regularly. All right, so things to know about stretching. So increases of range of motion are transient, meaning that they are short term. So if you go and stretch, you do a 20-minute stretching program after you work out, you'll see increased flexibility, but then by the end of the day, and certainly within a couple hours, you'll see it return back to the baseline. So if you want to actually improve somebody's range of motion, to improve their flexibility, it takes a really consistent stretching program in order to do that. So just something to be aware of. If you exercise and then stretch, you'll have increased range of motion, but that'll go away within a few hours. Part of that's actually related to the muscle temperature. So as you can see there, for longer lasting effects, have to do a consistent stretching program. The recommendations are 2 times a week for a minimum of 5 weeks to actually produce an increase in range of motion. And we're going to hold stretches at the point of mild discomfort. So again, thinking back to that hamstring stretch where you're going to feel that pull in your hamstrings. Mild discomfort, not painful, for 15 to 30 seconds. That's the point of holding it during a static stretch. All right, so when should we stretch? So one of the things that you're probably aware of is if you stretch before competition, so let's say we do a 5-minute warm-up and then we spend a good amount of time stretching before we start, that can actually reduce muscle power output And depending on the sport, if it's somebody like a volleyball player, that's a strength and power sport, and so we don't want to do things that reduce their power production right before they play. So for athletes like that, to increase range of motion, typically what you would do, if range of motion is a concern, typically what you would do is have them do 5 to 10 minute kind of a general warm-up, maybe some active stuff. So have them do 5 minutes of jogging, a bunch of lunges and Spider-Mans and inchworms and those kinds of things, dynamic warm-up stuff, and then maybe have them do some foam rolling. So foam rolling also, it's called myofascial release, is one of the other terms you'll see for that. That's also going to increase range of motion, but it doesn't reduce power output. So, and if you combine static stretching and foam rolling, that increases range of motion even more than just one or the other of them by themselves. So when do we want to do stretching? After practice. So we're going to have them, after they've cooled down, we'll have them do some static stretching after practice. Within 5 to 10 minutes of cessation of practice. And by doing that, that may help reduce muscle soreness, but the research on that is not clear. So it's not going to make them more sore. It may help, or it may not. So worst case, they're not less sore than they would have been otherwise. Best case, it does help and actually reduce the soreness, which then helps them to train harder the next time. We can also do flexibility training as a separate session. So, maybe we do that if we had a game Friday night, maybe we do it Saturday morning, do like just a light warm-up, foam roll and stretch to reduce muscle soreness, to get them moving. You could do it like that to help with recovery. And then, if it's something where you got an athlete that has low back pain related to tight hip flexors, that may be something that they do in the morning a couple days a week, outside of the normal resistance training sessions, outside of the normal practice times. They spend some of their time doing combination of foam rolling and static stretching to try to increase their range of motion in hip extension, for example, to hopefully help alleviate the pain in their low back, but also to help improve their performance. Proprioceptors. So some of this stuff is repeat. So stretch reflex is when you stretch a muscle really quickly, it is going to reflexively contract. So the classic example there is the old patellar tendon reflex. So if you're seated on a table or on a bench or something, last time you went in and got a physical, and the physician, athletic trainer, whomever, takes their rubber mallet and they tap your patellar tendon, then that's going to cause a rapid stretch of your quads, because remember your patellar tendon is the tendon of insertion of the quad group. So tapping the patellar tendon will cause a rapid stretch of the quad group. And in response to that rapid stretch, so the muscle spindles detect muscle stretch, but also rate of stretch. As a protective mechanism, they're going to cause reflexive muscle contraction. Essentially what the muscle spindles are trying to do is to keep the muscle from being stretched too quickly and being overstretched. And so they reflexively cause muscle contraction to try to prevent that rapid overstretch. So the stretch reflex then, as it pertains to stretching, static stretching, is that if we stretch too quickly, you're going to see a reflexive contraction. So if you're ever doing like partner stretches and you are doing, let's say, hamstring stretch, so your partner's laying on their back, you're standing above them and you're pushing their hip into flexion with their knee fully extended. If you do that really quickly, you're going to get this reflexive contraction. So to avoid that, you have to do the static stretches. You have to ease into them, if you will, to avoid that reflexive contraction. So the thing to know then, because I would imagine there will be test questions related to this. So the stretch reflex is mediated by muscle spindles. So the muscle spindles, if the muscle stretched too quickly, cause a reflexive stretch. It's called the myotatic reflex. We actually talked about that previously. So this is the same thing, just in another chapter. Autogenic inhibition and reciprocal inhibition. So autogenic inhibition is that if a muscle is contracted before it's stretched, then that will stimulate the Golgi tendon organs. Remember that the Golgi tendon organs sit in the tendon. Everybody remembers that, of course. Golgi tendon organs sit in the tendons, and or what they respond to, or what stimulates them to fire, if you will, to depolarize, is an increase in tension in the muscles, or a tendon more accurately. So an increase in tension in the tendon. And so if there's too much tension in the tendon, they cause reflexive relaxation. Or if there's tension for a prolonged period of time, they cause reflexive relaxation. So they're kind of the opposite of the muscle spindles in some ways. So usually when I talk about the Golgi tendon reflex, I talk about an example being if somebody's maxing out on bench press, they get stuck in the middle, and you see that they're right at the midpoint of the lift, and they're in this isometric contraction where the muscles are contracting as hard as they can, but the bar is not moving, and then all of a sudden they just drop the weight. That is the Golgi tendon reflex. So there's too much tension developed in the triceps, pec major, delts, etc. And so to prevent muscle tearing, to prevent muscle damage from generating too much tension, the Golgi tendon organs have initiated autogenic inhibition. They've shut the muscle down to keep it from contracting too hard. And we can take advantage of that from a stretching standpoint by having somebody do a contraction before we stretch them. And that particular type of stretching is called PNF stretching, and we'll talk about that in a second. Reciprocal inhibition is when the agonist contracts, the antagonist relaxes. So for example, if I contract my hip flexors, then to some extent that's going to cause relaxation in the hip extensors. So the antagonist muscles relax when the agonists contract. So that's reciprocal inhibition. All right, so how to do static stretching. Probably familiar with this. I'm sure you've done it at some point in your athletic career. So needs to be slow and constant. We're going to move them or move ourselves to the end range of motion, and we're going to hold that for somewhere between 15 and 30 seconds. If you hold a stretch for more than 15 seconds, that's going to initiate that response from the Golgi tendon organs, that autogenic inhibition, and that'll allow you to stretch a little bit farther. So what we're trying to do there by holding the position is actually to stimulate the Golgi tendon organs to help the muscle relax a little bit more to increase range of motion. Ballistic stretches are bouncing type stretches, so they're really explosive. You go to the end range of motion and then you bounce back. So fairly common types of ballistic stretches. Sometimes you'll see track athletes do them, especially sprinters, where they're like up against the fence and they're doing like different leg swings. Those are ballistic stretches. So they're moving, if they abduct as far as they can, they're going to do a ballistic stretch of the adductors, the groin muscles, and then they come swing it back across the body to stretch the abductors and then back and forth, right? So that's a ballistic type of a stretch. And then dynamic stretch is similar, but it's slower than a ballistic stretch, so it's not bouncing in the same way. So dynamic stretch is just you actively go to end range of motion, hold it there for a split second, and then move on to the next. So it's kind of it's an active range of motion stretch is what dynamic stretching is. This is kind of a repeat of the last slide. Yeah. Go till you experience mild discomfort, hold it for 15 to 30, and then you can repeat that for 3 or 4 sets if you want, but you can also get away with one set, like one hamstring stretch on the right, one hamstring stretch on the left, and then move on to the adductors if you wanted. But obviously, more repetitions is going to produce a greater increase, albeit transient, but a greater increase in range of motion. Dynamic stretching. So like I said, dynamic stretches, and these are in the supplement as well, which in Canvas is posted underneath the slideshow for this chapter, which is 14. So dynamic stretches are things like, usually they're this combination of lunges. So you do like a lunge and reach overhead. You'll do like a lunge and trunk rotate, to the right or to the left. They include inchworms, are a really common one, Spider-Mans, where you do a lunge with your elbow to the instep, and all of these are pictured in that supplemental guide if you want to check them out. But those are all different kinds of dynamic stretches. So you go through active range of motion as far as you can, and then you move into the next one. PNF stretching is one that you may or may not be familiar with. You might have done it with an athletic trainer or with a physical therapist at some point. There's 3 types of PNF stretching. The first is hold relax. So the easiest example and the most common example of PNF stretching is for the hamstrings. So let's pretend, you gotta visualize in your mind, you're working with an athlete, they are lying supine, so they're on their back, face up. And so what you're gonna do is you are going to stand over them if they're on the ground, and you are gonna grab their heel, and you're gonna flex at their hip, and then keep their knee extended. So it's just a straight leg hip flexion type of a thing to stretch their hamstrings. So for hold relax, you're gonna go as far as they can, and you're gonna hold that for 10 seconds. And then you're gonna say, okay, I want you to push for 6 seconds as hard as you can. You may not say as hard as you can if they're a really big athlete, but push for 6 seconds. And so what you're going to do is you've taken them to their end range of motion of hip flexion, so you're stretching the hamstrings. They're going to push, push, push with their legs straight while you hold it in that position. So you don't let them move. You keep them in that position, and they push fairly hard for 6 seconds, and you say, good, relax. And then they relax, and you push them a little bit farther, hold for 10, and then push for 6, hold for 10, or the way they've got it laid out here, you hold for 10, push for 6, hold for 30. More commonly, especially in a sports medicine context, it's typically 10, 6, 10, and then you do that 3 times, so 3 separate 10-second passive stretches, but we'll go with the NSCA guidelines because we're being tested on their guidelines, so we'll go with stretch them for 10, contract for 6, and then stretch them for 30. So that's hold, relax. You hold that position. As opposed to contract, relax, what you're going to do, it's a little harder. It's easier to do if they're on a table with the hamstring example. But what you're going to do is same start. So you take them to full range of motion in hip flexion, and you say, okay, I want you to contract, and you basically, as the athletic trainer or the physical therapist, whatever, strength coach, they're going to bring their heel all the way to the ground, and you fight them the whole way. So it's a really slow motion. You're fighting them as hard as you can, but let them keep moving. And then once their heel comes all the way down to the ground, you say, okay, good, relax, and then you push them all the way back. And they'll go a little bit farther this time into hip flexion, and you hold it for 30 seconds. So hold, relax is an isometric contraction. They hold that position, or you hold them in that position more accurately. Contract, relax is you resist them through the full range of motion, and then you stretch them again. And then hold, relax with agonist contraction. I learned this one as slow reversal hold, relax, although I don't know that title is much more easy to remember and understand what it is, but that's how I learned it. But it is very similar to contract, relax. So basically you do the whole contract, relax thing where you take them to end range of motion in hip flexion, say, okay, contract, I'm going to fight you all the way down to the ground. And then once they get down with their, once their heel comes in contact with the ground, you actually have them contract the hip flexors. So they help you as you push them back into hip flexion, and they continue to contract their hip flexors. And so what you're trying to do there is to get that reciprocal inhibition. As they're contracting the hip flexors, that should cause the hamstrings to relax even more, and so then hopefully we'll get them even farther into hip flexion. So same basic process. So all it is isometric contraction, concentric contraction with, or followed by an agonist contraction. And then these are almost always done, the PNF stretches are almost always done for the hamstrings, but you can also do them for the groin. There's a picture of that in the supplement, which frightens me. I feel like mine might pop if somebody did that to me, but whatever, you could do that. There's also pictures of the chest stretch, and then shoulders, etc. So those are common types of PNF stretches, but like I said, the hamstrings are by far the most common that you'll see in a performance setting. And that's it. That's all for the warm-up. So this one is a pretty short one, less than 30 minutes, so that's good. So next time we'll move on to chapter 15, and we'll talk some about free weights, but not much. Most of that slideshow is actually about like different kinds of grips and stuff. So that one will be really short, and then as we progress along, they'll get longer again. But kind of for this middle part, we all get treated to relatively short lectures. So good luck on this week's quiz, and we'll see you next time.